Jonathan Javitt, of course, good friend of the program, founder, director, chief scientific officer, and now chairman of the board of a company called NRx Pharmaceuticals. We've talked about suicidal ideation. You're going to see their Bizumentary. Yes, thanks. I get paid a nickel every time somebody says it on TV.
Yeah.
Ooh. The Bizumentary is coming out here on Biz TV as well as on Bloomberg and potentially coming up on Bravo. Or I beg your pardon. Bravo? There's Ovation. Bravo. Ovation, right? See how I get mixed?
Both great.
Long story short is, we have a pretty good press release, and things are moving forward. We've talked to Mike Taylor, our financial expert, about Hope Therapeutics and what's coming from that. News keeps getting better for NRx, and guess what I got? Because we're important. Jonathan Javitt's here. What's up, bud? Great to see you. Hey,
it's been a busy week.
It's been busy. Let's talk about, I want you to take it away because it's some pretty good news today in the market in terms of investors believing in NRx by putting in some money into the company. Talk about that.
Well, we're excited that one of the better and more thoughtful biotech funds out there, Anson Funds of Toronto, chose to bring in what will be between $10.5 and $16 million in convertible debt, and that's enough to get our drugs filed with the FDA.
You know, it's interesting. We were talking about this the other day with Mike Taylor, who's a financial expert on the program, who I know you're familiar with, saying that it's a different type of investor that takes literally the long soak. Mm-hmm. It's a fishing term. Thank you very much. Let's talk hookup. But it's a 7-year turnaround oftentimes for a startup investor into a biopharma firm because you got to go through FDA and you got to go through the bells and whistles. And oftentimes you got to raise money in between. So it's not a small task for a company like yours to go raise money. And it's a testimony to investors believing in what you're doing. So that's some good news.
Well, and in our case, it's been a brutal task. We started this company in 2015, and I went and saw the usual venture capitalists, and they all asked me the same question, which is what keeps you up at night? And I'd always have the same answer, which is, well, I worked on the SARS epidemic in the Bush administration, and a global pandemic would be really bad for our business. And because we're making the drug in Shanghai, which we're not doing anymore, a trade war with China would be really bad for our business, and they would all laugh. Well, it turns out we got both of those, and we survived both of those, and now we've got drugs that are ready to file with FDA and hopefully be on the market in 2025. So it's an exciting time for us.
Hey, Dr. Javitt, 2 questions for you in terms, I want to get to the drugs in a second, but I want to talk about, you talk about 2025. Do you expect to take this to market to yourselves, or do we do what they call that risk aversion model and have a larger biofirm come in, pick up the ball, take it to the finish line, and you're working on your next drug? Can you share what your thoughts are on that?
Certainly for ketamine, which is a drug that's not a home use drug, it's a drug that's going to be given in clinics. We know who those clinics are. We're already working with those clinics, and through our Hope Therapeutics division, we expect to own some of those clinics. So when you've got a potential customer base that's under 1,000 people, there's no reason to work with a large pharmaceutical company. They can't really address a market that small, that compact, very readily. So we're certainly going to do that by ourselves. Now, our second drug, NRx 101, that's anticipated to be a home use drug, is one that'll likely be prescribed by fewer than 1,600 psychiatrists in the United States. And that, too, is a footprint that a small company can address, although a highly motivated partner would be great to have. So,
in my opinion, for you, you now have runway to complete the drug task, and then let's bring up Hope Therapeutics, because I think that's the pot of gold at the end of the rainbow. Can you share on that, where this puts us now?
Well, we have runway, we have a motivated investor, and we've got data that keeps getting better. So we've been talking about data that we're going to be presenting to FDA from about 1,000 patients, showing that ketamine is better than placebo, it's better than active comparator, it's as good as electroshock therapy for treating people with suicidal depression. Well, just this week, a study of approximately 43,000 patients, not randomized and prospective the way the FDA wants, but an observational study, what's called a cohort study, was published in a leading journal, showing exactly the same effect for ketamine. in reducing suicidal ideation and depression. So we have a drug that patients need that's rapidly becoming the standard of care. That's a life-saving drug, and that's an exciting place to be.
Dr. Jonathan Javitt, founder, director, chief scientific officer, NRx Pharmaceuticals on the
Not to
NASDAQ.
mention chairman of the board.
Chairman of the board, excuse me, sir. Also NASDAQ NRXP.
Howie, you got a question?
Dr. Javitt, pleasure to see you, sir. Congratulations on the deal. How important is it? I noticed that Anson Funds came out with a very strong statement saying, we believe in the science, we believe in the long-term vision. How much more efficiently are you operating with a partner rather than, someone that wants a deal done quickly?
Well, I think that it's a challenge in this market to find an investor who's committed to long-term success and not just committed to how quickly can we churn the stock. And as we've all seen, there are too many technical investors, and we've suffered from some of those. But the problem in the biotech market is investors who are going to take a long view, who are in the company to make patients' lives better.
And
not to be out next month.
I think the story is that after today's deal, you're past that. Well, maybe everyone else isn't.
I would agree. Yeah. There you go.
Well,
Big Biz Show. Dr. Jonathan Javitt, chairman of the board, CEO, chief scientific officer, director of NRx Pharma. That's some good news. You will look for the Bizumentary on NRx and suicidal ideation coming right here on Biz TV.